Hey everybody, it's Dr. Eric Balcouch. Welcome back for another edition of Thyroid Thursday. And today we're talking about the timing of your medication in relationship to when you do your blood draw, especially if you're taking a T3 based medication. So I get this question a lot when I'm talking to people. Does it really matter when I take my medication? Their doctor doesn't tell them it makes a difference. They just say, get your blood draw, and they don't give them instructions on when to take the medication, especially those who are taking T3 based medication. So I want to give you a kind of dramatic example of how much T3 can change a set of labs when it's not taken before a blood draw and when it is taken before a blood draw. All right. So this is a patient who is taking 50 micrograms of T4, 25 micrograms of T3, and this set of thyroid panel was taken 15 hours after the last dose of T4 and T3. So TSH is 0.397. It's essentially being suppressed by the amount of T4 and, more importantly, the amount of T3 in the system. Total T4 is 4.2, so there's less available T4 in the system. Total T3 is 108. That's within most people's optimal range. Free T4 is 0.65. This is lab low. Free T3 is functioning low at 2.7. And this is reverse T3 is at 10.1. Now, this is a person who might assume that, hey, maybe I need more T3. I still have hypothyroid signs and symptoms, and my free T3 is a bit low at 2.7. But they haven't taken their T3 medication in 15 hours. Now, the half-life of T3 is somewhere between 12 and 24 hours. So even at 15 hours, we're still seeing some of the residual T3 medication in the system. The free T4 ratio, I put these on there, but these do not matter because the person is taking T3 medication. It is the same dose, but the timing is different and it doesn't bear much, so I just cross it out. So then after we had this done, we then, on a follow-up day, we had them redraw the labs. I think it was 5 hours post taking their T3 and T4 medication. Now, the half-life of T4 is about 7 days, so it doesn't matter as much. But taking that T3 medication before the blood draw, TSH dropped to 0.125. So that TSH saturating the pituitary, or the free T3 is saturating the pituitary gland, and that's dropping TSH. That's going to result in reduced T4 production by the gland, okay? Total T4 did go up, though, at 4.6. Why? They had a little bit more thyroid medication, maybe before the blood draw, T4 medication before the blood draw, but more importantly is they've got so much T3 in the system now, that T4 doesn't need to be converted to T3, so T4 is going to go up. Total T3, it jumped by 70 points 3 or 5 hours after taking the medication dose. So now a person who looked functionally low at 108 now is almost lab high at 178. So dramatic rise. Free T4, it went up to 0.75. Why did it go up? Well, the total T4 went up, but there's more free because it doesn't need to be converted to T3 because there's so much T3 in circulation. Free T3 went up from 2.7 to 4.0, so from maybe functionally low to at the upper end of the lab reference range, and that's a 1.3 swing. And then reverse T3 went up to 13.1. Why did it go up? Not because they're taking too much T4, but because there's so much T3 in the system. And this is a person who might still have hypothyroid signs and symptoms despite taking a large dose of medication. Why? Thyroid hormone availability in the blood doesn't necessarily correlate to optimal thyroid physiology inside all cells and tissues. So if you're a person taking thyroid medication, especially T3 based medications, T3 only, Armour, NP thyroid, something along those lines, you need to talk to whoever is ordering that lab draw to find out when they want you to have your blood draw done. Now, there's an argument between how long it takes for T3 to peak in the blood. Some papers say anywhere from 1 hour to 4 hours. Some say anywhere from 4 hours to 6 hours. Some say it's around 2.5 hours. So anywhere, I would say, between 3 hours and 6 hours, if you're taking your labs after a T3 dose, you're going to see what the T3 medication does to your labs. And I would suggest not just looking at the thyroid panel, but looking at some of the other labs. You should see a dramatic change in cholesterol levels, in LDL and HDL levels if you're taking T3 medication. If you don't, there's a bigger issue going on. But you want to know, because if you were this person and you were seeing you didn't take your T3 medication before, you went in and showed your doctor the labs, and they're providing T3 medication based on this, they may actually give you more medication because they might say that your free T3 is too low at 2.7, so they need to give you more. When in reality, had you taken that thyroid medication, especially that T3 medication, prior to the blood draw, then they would see that, oh, there's plenty of plenty of T3 in the system. It's not about availability, it's about how it's used inside the cells and tissues. And so that persistent hypothyroid signs and symptoms is a result of what's happening inside some of those cells and tissues, not about how much is just dumped into the bloodstream. Definitely some symptoms will change, but it doesn't mean all symptoms will change and hypothyroid signs and symptoms will go away. And we've got to be careful that with all that T3 in the system and the upper levels, that we don't have more anxiousness, more anxiety, more brain fog, more insomnia, more hyper type symptoms in some of the tissues. All right. If you have any questions below, if you have any questions about this video, put them below wherever you watch the video. But make sure, if you're taking T3 based medications, to ask your physician what they want you to do regarding timing of your medication. Many times when I'm seeing patients and they're on especially smaller levels of T3, I don't necessarily want to see them take the T3 medication before the blood draw, because I want to see how well they're converting the T4 to T3. So we'll try and get to a 24-hour period without T3 before we do the blood draw. But if we think that the T3 dose that they're taking might be appropriate for their situation, then yes, we might want them to take their T3 medication and somewhere 3 to 5 hours later have their blood draw, so we can see, does that T3 medication bring you up into a more appropriate range, and what does it do to the rest of the thyroid panel, your signs and symptoms, and the rest of your labs. Hopefully this helps. If you have any questions, put them below wherever you watch this video. Take care.